P is for prognosis. And this is simply another way of telling you what your risk is of surviving breast cancer or how likely it is to spread and you end up with stage 4 disease. Now, your doctors work it out using several bits of information, including how old you were when you were diagnosed, what grade it is, how big it is, whether your lymph nodes are involved, and what your receptors are. We can also use extra tools like Ki67 and Oncotype, which I've already talked about in this series. They plug them into a computer model called Predict, and what that does is tell us the benefit of treatment for you and the likelihood that you will still be alive in 10 years. Now, that can be quite scary, knowing that you have a 20% chance or a 80% chance of being alive in 5 or 10 years. It's really worrying, and I used to fixate on that a lot, but this is the thing. That is the worst case scenario for you. Because to get 10-year data, the trial that did that had to be at least 12 years old because it takes time to collect the data and print it. And new drugs are being developed all the while, and the women in that trial may not be on the drugs that you're on today. And this is another thing to realize. No one can tell you which group you are in. You may have a really bad outcome and be really worried because your prognosis is bad. But no one knows if you're in the group who are going to get metastases or the group who aren't. And actually, it's 50-50. Your cancer comes back or it doesn't, and it's what you do with the information. And it paralyzed me in the beginning. I would focus on the bad. And after a couple of years, I kind of realized it's out of my control. No one can tell what my cancer is going to do in the future. All I can do is take the drugs and live as well as I can. So that's what your prognosis means. Your doctor may not tell you unless you ask, and you may not want to find out, but that information is there if you want to know. And tomorrow, we're moving on to Q, and that's been quite a hard one.